righty, welcome everyone to the June 13th, 2022 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn?
Dan Finn, present.
Austin, we know, is running a little late on work travel. Bill Muller?
Bill Muller here, sorry.
No problem. And then Jennifer Maynard.
And Mayor here.
All right, and then staff and anticipate speakers on the agenda. When I call your name, please respond in the affirmative. Nancy, I'm not sure if she'll make it. And then Jerry Tangri from the Alliance.
Here.
All right, thank you and welcome. And we appreciate you joining. And also taking one for the team where Colleen couldn't make it. I'd like to open the meeting. Can I get a motion to open the meeting?
Yep, this is Dan Finn. I'd like to make a motion to open this meeting.
All right, is there a second?
This is Bill Muller. I'll second that motion.
All right, thank you, Bill. And then all in favor, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gwiazdowski-Govin, aye. All right, good evening once again. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency. This act includes an extension until July 15th, 2022 at this point, of the remote meeting provisions of Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. This meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may see you and that you take care not to screen share your computer because, as we all know, anything that you broadcast could be captured by said recording. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first item on the agenda, I'm just going to cover a few basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers for any topics on the agenda. After they've concluded their remarks, I'll open it up for the board members to provide any questions, comments, etc. As always, please identify yourself by name when speaking. Please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly in a way that helps generate accurate meeting minutes. And then finally, any votes on any motions made during this evening's meeting will be conducted by roll call vote. All right, with all that being said, the first item on the agenda is the Alliance updates. So Sherry? On behalf of Colleen.
Hi, this is Sherry on behalf of Colleen. So I'm just reading off what I have. Regional Youth Health Survey data for Grafton has been provided to the Grafton Superintendent. Reports forthcoming. Second item is Regional Public Health Nurse position is posted and it closes on June 24th. Deputy Director position to be posted this week. And the fourth item is Colleen is asking, please share any tabling or community events you would like to request our presence at with as much as notice as possible. And Worcester DPH Alliance strategic plan and business plan will be rolled out this summer. That's it from Colleen.
Right, and I think Nancy, when I was trying to quickly catch up on emails, I think Nancy had sent out to the board members this afternoon, the inspections. If anyone has any questions that can be taken back to Julie or Colleen. Dan?
Yeah, just a couple of questions that Sherry may not know about, but just wondering where they're going to have the actual pig roast for the Townhouse Tavern.
That's already
Obviously.
happened. That already
Okay.
happened, Dan.
Okay. So-
That I know. That already happened. Don't ask me where it was held, specifically what part of the property, but I know it already passed.
Okay, then that's fine. It must have been just outside the back door there. And no, just, and it's not critical. On Bushel and Peck, there was a trash complaint, which I'm sure they can clear up. I don't know about an AC being loud, whether they can do much about that, but I can check with Julie. It's not critical by any means. That comes under noise, I guess, or something.
Yes.
But I do have one more question for Sherry,
Yes.
and I'm jumping ahead a little bit because we're going to discuss it in a few minutes. Whether the city of Worcester or Shrewsbury, if you know, or any other local towns have either rescinded or done anything about the mask. Obviously not mandates, the mask
Advisories.
advisories. Do you happen to know if they've done anything with that, Sherry?
No, I'm sorry. I do not have that information.
Okay, that's all right. We're going to kind of discuss that in a little bit anyway, under our COVID stuff, but thank you. And just wanted to mention, we'll have to get Nancy to help us get a thank you card off to Colleen somehow in the next couple of weeks, hopefully.
Yeah.
That's all.
Agreed. Yeah, I was surprised when I saw the notice that she was leaving. I mean, happy for her, obviously, to be taking on a new challenge and everything, but she's been a great partner to work with throughout all of this. And even prior to the world of COVID, she's been a great partner. So definitely, as Karen Clark's email said, definitely bittersweet. Happy for her, but definitely sad to see her going.
And just one more thing, this is Dan. It's probably gonna require the Alliance to help us find someone to fill her spot on the Tufts Bio Lab Committee. But we can deal with that next month probably.
Yeah, agreed. Along with, I can just imagine how much other stuff the Alliance is going to have to fill until they get, her replacement obviously in there. Right. Jen, Bill, any questions or anything? All right. Well, thank you, Sherry, for filling in for Colleen on that. We appreciate it. All right, next topic, COVID-19 cases, vaccines, and mitigation efforts. I know the case reporting counts are a little delayed due to overlapping, I think, one of the individuals on leave, and so we don't have the latest and greatest weekly case count prior to the meeting, but as of June 3rd, we had a total of 3,498 confirmed positive cases since we started tracking back in early 2020. The counts from a weekly basis are definitely down some. We're seeing more like in the 30s, et cetera, for when we've been talking the most recent weeks. Not down super far, but definitely down compared to when the board met to talk about whether the board wanted to put in an advisory for masks again or not. But happy to see they're at least trending downwards and not going in the opposite direction or staying at that same level. So already mentioned the advisory, which we'll talk about in a moment. Regardless, we continue to strongly recommend that individuals continue to wear masks, especially in heavily populated indoor locations. For those individuals who are or come in contact with high-risk individuals, such as immunocompromised individuals and the elderly, we're continuing to monitor the case counts and trends. And also, obviously, we're monitoring, as everyone is, as to whether any new variants are starting to show up, both in the US or in other countries. In terms of vaccines, there's been a few updates in terms of recommendations. So rather than breaking it down into the multitude of different vaccine types, age ranges, et cetera, the easiest place to go is to go to the CDC's website or the Massachusetts website regarding the COVID-19 vaccine options, any updates regarding either initial vaccines, boosters, additional doses for the immunocompromised population, et cetera. So in terms of mitigation efforts, as we mentioned, the board had during the May 23rd meeting, I think it was. I was traveling for work, so I think that was the date.
Right.
The May 23rd meeting had voted based on the way the case counts were trending at the time to issue a mask advisory, not a mandate, an advisory for the town of Grafton. And so as discussed, anytime we have, whether it be an advisory or back when we had a mandate, each meeting that we have, we revisit that. So we put that on the agenda for tonight to discuss the current advisory that's in place. So I wanted to open that up to the board members. On terms of thoughts, I think you voted to have it go until June 24th. I think it was effective May 24th to June 24th, if I remember correctly. Dan?
Yeah, this is Dan. I think today the state issued, I just read it briefly, a statement saying that the Boston schools don't have to wear masks, but they also said it should be a personal preference. I mean, personally, I don't think we need to amend or suspend anything and maybe just stick with the 24th as the advisory. I kind of think it's still a good idea for a little while. I mean, we got through graduations and some graduation parties. As you said, the cases are kind of down, but I don't think personally that we need to adjust that and just let it expire. On the 24th. I don't know what Bill or Jen think.
Bill?
Yeah, I think there's relatively low compliance with the advisory. I think at times when I'm in Stop and Shop, I feel like I'm the only person wearing a mask. But I still think there's justification to recommend mask wearing. Clearly, it's encouraging that the numbers are trending downward. I don't know that it, from a practical standpoint, increases the number of people wearing masks. Apparently, it doesn't. But I don't know if there's any downside to still having the advisory there, because that's based upon, trending of what the case counts are and so forth. I still see our signs on the roads in the town and things of that sort. But I think it'd be reasonable to let it continue through the previously determined expiration date and probably not reinstituted at that time unless the counts begin to trend up again. I mean, I think some of this is the natural history of the epidemiology of this disease. We're into the time of year when people are outside a lot more. We're not in confined spaces quite as much. I think the surges in the past have largely happened during the colder months and, as we move into the fall and so forth again. So I think it's reasonable to say that we're still in favor of masks in indoor settings, that we'll reevaluate it if the case counts change.
Yeah,
Jen?
I think that makes sense as well. I mean, I think I had seen somewhere that a pandemic like this usually lasts anywhere from 3 to 5 years. So we will likely see these hiccups and that we may, find that we need to do it again, as Bill said. So, I think at this point, if we let it expire and, not renew it at this point, we may have to just readdress or make recommendations down the line. But we're getting to that sort of the way of the world right now and just kind of managing through.
Agreed. All right, so yeah, we will proceed with letting it, run through the July 24th expiration date that had been determined by the board back in May. Obviously, keeping a close eye on the case counts, the trends to see, how this proceeds. Dan?
That's June 24th. You mentioned July 24th.
No, sorry, June 24th.
Thanks.
Sorry, yes, June 24th. And thank you, Dan. That was previously determined in the May meeting. Thank you for catching that. Too many dates flying around today. It's been a long day. All right. Anything else on COVID before we jump to the next topic, which is technically COVID related also, but separate? All right. The next topic is BioBot COVID surveillance program. So there's, for anyone who's not familiar with this, this is related to surveillance of wastewater and the testing that's done on the wastewater to see potential COVID related trends in terms of, an upcoming or an existing spike in cases or a surge in cases. So it sounds like the Grafton, let me step back one notch. The more regional side of the world from a wastewater plant had been part of, was like a study that had been going on regarding this. And so that's where we'd been getting our data from via like the Alliance and everything, from pure wastewater, not from actual cases, not vaccination counts, that type of data, but from this pure wastewater data had not been coming directly from Grafton's wastewater. Now, it sounds like there's opportunity for Grafton to be part of said study for at least a period of time. And so, which is great, obviously. The question before us specifically is whether we feel the wastewater data related to COVID should come from the Board of Health or the Health Department as part of the larger COVID data that we provide, whether it be the weekly case counts, the age ranges, the vaccination data. We've been the one already taking the more regional data and publicizing it out. Or should the now Grafton specific data come from the sewer department in town as its own reporting versus us getting that reporting and then putting it with the rest of our COVID reporting? So that's what we're talking about. Whether we think it should be us with the rest of the data or the sewer department separately from any other COVID related data. Dan, I think your hand was up.
It is, thanks. Yeah, I think it's reasonable of Director Paul Cournoyer to ask us to do it and incorporate it with all the other information. And William, I think, can help put that together with Nancy. It doesn't seem like it's going to be very tedious if he can convey that information to her or to her office. And I'm assuming it's going to be maybe on a weekly basis. I don't really know how often, but I think it's reasonable for us to take that publication piece.
Bill?
Yeah, I would agree. I think it's complementary to the other reports. It would be probably not very helpful to have it come as a separate report from a different department. I would agree. I mean, I think it's to some degree a rhetorical question, that this makes the most sense. We're already doing the reporting of the other metrics, so we'll add this to the metrics. Presumably it will be congruent with the other metrics so that when the wastewater numbers are fluctuating, they'll fluctuate, you know, I mean, I don't know offhand what percentage of people in Grafton are on the public
Yeah.
sewer though. There's a fairly large part of town that I think is not really on the sewer.
Yeah.
I think on one of these reports, it said that there were a bunch of septic systems that were about to be evaluated in the east part of town. So
Yeah, it will be something that, you know, we and others will have to keep in mind. Like you said, there's definitely a decent amount of properties that aren't going to be part of like this ongoing data surveillance just because they're not putting the wastewater into said wastewater treatment.
system, yeah.
All right. So yeah, that was more, we'll call it a formality that, you know, was brought before us just to make sure we all agreed before anyone gave the, yes, we'll do it, to Nancy type of answer. All right, so the next one is the primary reason Sherry was here in the first place for this evening is we're revisiting, it was a couple meetings ago now, with the state tobacco regulations, where there's that one piece where there's the permit suspension guidelines and the state left it up to the local boards of health to make the determination of the number of days that if a tobacco establishment in your town is found violating, I think it's just purely the sales under 21 piece of this, that if you're found for the first violation, each community can make the decision on that number of days. The state's not dictating that number of days for that violation. So the last time we spoke about this a couple meetings ago, it was kind of, we'll call it relatively new to all the communities, and we didn't really have any data in terms of what are others potentially looking at. So that was the ask of us back to the Alliance, et cetera, to see like, are we talking 3 days? Are we talking 14 days, 1 day, 7 days? We just didn't want to be kind of what one would call an anomaly in an unknown data pool. So we're back tonight with this because now we have the data. And Sherry, I don't know if you want to go over, I think Nancy had sent out.
Yeah, I have it with me. So the municipalities have made a decision on the suspension length mandated by state law for a first-time violator who sold to a minor. They are as follows. So the city of Boston, Chelsea, Chicopee, Everett, Gloucester, Peabody, Revere, Salem, and Somerville chose 3-day permit suspension, and the towns of Essex and, oh, that's just one town, chose a 3-day permit suspension. Sorry, the city of Chicopee chose 1-day permit suspension. And then Melrose and Wakefield went for 5 days. And Worcester, I spoke with Karen about it, and she also said she'll also go with the most popular number, which is 3 days. And I also spoke with Cheryl Sabara and Sarah. So they said it is the board's decision. They do not have to publish a summary about this in the newspaper. So once you vote on it, and it would be effective. And then at some point when Grafton updates their regulation the next time, we can put it in the regulations at the time.
That was going to be my question. Like,
Yeah.
okay, great. We, talk about it, we vote on it. Do we have to, I know poor Nancy's, probably, she's not on. That was going to be something I was going to ask her. Like, are we all cool with all of the previous regulation update we just did? And least then if we don't have to rush, because I'm sure, if it's not fully done, I'm sure she's well underway. I wouldn't want to tell her you did all this work and now you've got to stop and redo it all again.
Yeah, that was my concern. Like, does the board have to like go through the whole process again? And they were like, no, it's just a voting at a regular Board of Health meeting. And there are benefits, like it's a benefit for retailers and enforcement agents that, there is a clarity on what is happening, and it will be fair to all retailers. Like one retailer would say, oh, I get a 7-day suspension, whereas my neighbor retailer is getting just a 1-day suspension. So just to be fair.
Great. Dan?
Yeah, this is Dan. I agree with the 3-day number. I mean, it's obviously the most popular, but not necessarily for that reason. It just seems to make sense to me to make a statement, but not really tremendously penalize somebody's business. But 10 out of the 13 municipalities that DJ Wilson sent to us are in fact 3 days. So I would vote for that if we have a motion, but I don't know what Jen and Bill think.
Bill,
This is Bill Muller. I would agree.
Yeah, same. I think we should align with some of the other communities, or the majority of the other communities are doing.
Dan?
So may I make a motion that we as the Grafton Board of Health have a length of time for a mandatory suspension for a first-time violation for anyone, for any company that violates and sells tobacco to a person under 21 years of 3 days.
Is there a second?
This is Bill Muller. I'll second that.
No, one thing, Dan, just before we get to voting. Is
Yeah.
that 3 consecutive days
I was just going to ask
or
that.
3 days?
Three.
Because
No,
Calendar
3.
business.
I just, before we got too far, I was like, wait, we have to clarify that, because otherwise we're going to be back here when
Right.
hopefully we don't have anyone that violates, but I don't
Right.
want us to get into the if and when, hopefully it doesn't happen, we get someone's like, well, can I space it out?
Right.
Avoid
So that's a
weekends or
good, that's a
something?
good point. So I would amend that motion to say 3 consecutive days.
Right. Bill, do you?
And I would second the amended motion.
All right, now roll call vote.
Dan Finn, aye.
Bill Muller, aye.
And Maynard, I.
Karen Gwiazdowski, Govan, aye. All right.
I just wanted to give additional information that when a permit suspension is given to a tobacco retailer, so I would call them and determine a day, and then pull all the tobacco products, and we post everywhere that they cannot be selling tobacco for these 3 dates. And then after that, they are all good to sell. Anything that contains tobacco will be pulled off the shelf.
Thank you. Yeah, it's been some time, which is
There we go.
Yeah.
Yes, Sherry, thank you. And also it was helpful to get that other information, the other documents, including the correction/cease of desist order, which is obviously very official and legal. So it was helpful to see that information. Thanks.
all right. Thank you, Sherry. All right, next is to be signed. So this is the permit to operate a biomedical research facility at Cummings School of Veterinary Medicine at Tufts University, 200 Westboro Road. The board was sent the results of the inspection that our new inspector had completed recently. Did the board, before we get to the actual process for signing the permit, since we're virtual, before we get to that, do any board members have any questions? Dan?
Yeah, this is Dan. I just want to comment that I thought Holly yeah, Colleen Driscoll's report was very comprehensive and as we suspected it would be after interviewing her. And that it was really good to know some of the stuff that goes on and some of the people that are involved at those locations. And so kudos for her, to her, for putting together what I thought was a really good report.
Agreed. All right. So the process, since we're not obviously physically sitting in the room at this point, I confirmed with Nancy that the best way to do this, so we don't hold it up, obviously, is for us to, motion, second, vote, and then Nancy can sign an initial on behalf of the board. So at least it gets it on its way to Tufts and we're not delaying it at all. And we've done that in the past with other permits being virtual. So with that, is there a motion to approve and sign? Dan?
My unmute button, yes, thank you. Yeah, I'd like to make a motion that the Board of Health sign the permit to operate a biomedical research facility located at Cummings School of Veterinary Medicine at Tufts University, 200 Westboro Road, North Grafton. Effective June 13th, 2022.
Second?
Ms. Billmuller, I second that.
All right, and then roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Jen Mayer, aye.
Karen Gosowski, Govan, aye. All right, thank you, everyone. All right, old/new business. I'm going to skip over asking Nancy what the status is of the tobacco regs that we had put in place. Village Dairy, follow up with that since we have Sherry. I can at least ask Sherry. Coming out of the last time we spoke about that, which might have been 2 meetings ago, I think, early May. I think if, in my notes, the take back out of that was that you and Nancy were gonna connect to get something over to the owner of the Village Dairy, communicating that we understood he couldn't attend that May meeting and we'd be willing to have him, let me see, some type of letter or with the corrective action plan, or he could come in and outline what type of actions and corrective actions he was going to put in place. So I didn't know if Nancy had reached out to you about that and you guys had connected.
No, I did not hear about that, but I did hear about that the board was going to send the retailer a certified mail letter. That was my understanding. Because I already went and did the retail education for all Grafton retailers for the new regulations last month. So if I knew, I would have communicated that for sure. Yeah, but so a letter was not sent to the retailer?
You'd have to check with Nancy because she's not.
If that was not.
He did pay the fine. We found that out after the meeting, that he had in fact paid the fine.
Oh, then I think that's fine. Yeah, but I can, like, for the future, I can always provide a template that I write and send out to the retailers in Worcester. So I can always send the template and you can change the address and all the other information.
All right. Any questions, board members? Dan?
Yeah, I think we ought first have to start with Nancy and see what she knows about any response. And hopefully she can get back to us before the next meeting. We can go from there.
Agreed. All right. Thank you, Sherry. All right. Besides that, just a reminder to everyone that tick and mosquito season is here. So a reminder for the 5Ds and taking the precautions that we have posted every year, multiple times on the website for the Board of Health to make sure also, as part of that, make sure that you're not only taking the precautions, but then also checking after you or your animals have been outside when it comes to ticks. For checking, especially you get some animals, I know some dogs especially get like that really thick fur. Trying to, check for ticks is not easy, but it's definitely worthwhile since there's a variety of tick-borne illnesses that can be transmitted to humans. So worth taking the precautions since we're early on in the season still at this point, so we have some time to go. And then I did want to, Dan.
Just wanted to mention, I understand some cats have thick fur too. I don't know personally, but
Yeah, there are. I was thinking all my cats are indoors. But yeah, there are some, especially you get some of the longer fur ones that definitely would be troublesome trying to get down to the skin with some like Maine Coon kind of length fur and everything. So besides that, I just wanted to mention that, I don't think didn't really have much in terms of this happening yet, if I remember correctly, but monkeypox, I would be remiss not to at least mention the fact that monkeypox is something that has cropped up, not just where it's endemic in Africa, but now there's a host of cases. I don't have the latest case count globally, but I think the last time I looked, it was 700 something globally, but don't quote me on that. But in Massachusetts, we're now up to 3 definite cases of monkeypox. I know there was one in Rhode Island that they mentioned over the weekend. But that being said, all of that is not to alarm people. Obviously, there's plenty of information out there around like the risks, how you can potentially catch monkeypox, interactions to avoid, symptoms, signs, what to do if you think you've been exposed. And the best places for that are obviously both, I think Massachusetts has information, but definitely the CDC has information. Not something that anyone to date is thinking in the medical community is going to turn into something like a COVID, where, because that was the immediate concern that everyone had when it first cropped up. Is this the next COVID? To which everyone is saying at this point in time, they do not believe that this, based on what the actual disease is and how you transmit it, that we're going to be talking anything like COVID. But that being said, it's worthwhile for the population to know it's out there, and just to get educated on the concerns around it. Let's see. I don't have any old or new business besides that. Correspondence-wise, I don't have anything. So that leaves upcoming meetings, July 11th, I think it is. Let me just double check, get it on here. Yep, July 11th, August 8th, and September 12th.
Right.
So yeah, so those are the next 3 meetings that we have. All right. There's nothing else. That was all we had for topics this evening. Dan?
That being said, I would like to make a motion to adjourn this meeting.
I will second that motion.
All right, roll call vote to close the meeting.
Dan Finn, aye.
Bill Muller, aye.
Ben Maynard, aye.
Karen Gustowski Govan, aye.